My name is May Faraj. I'm an associate professor at University of Montreal of Nutrition, and I direct the lab of nutrition lab proteins and cardiometabolic disease at the Clinical Research Institute of Montreal. I presented here at the International Academy of Cardiology in 2018 in Boston, and the presentation basically was about looking how sometimes the risk factors for cardiovascular disease and diabetes are not necessarily the same, that we know that there are common risk factors such as obesity, aging, metabolic syndrome. However, recently over the last 10 years, there is more evidence that the risk of cardiovascular disease and diabetes can be inverse, and that's depending on receptors like LDL receptors on the surface. If we have a functional receptor, then the risk for diabetes increases. If we do not have functional receptors on adipose tissue, then the risk for diabetes decreases. And basically, I showed studies in our laboratory clinical research on how we can select populations based on a plasma protein, which is a PCSK9, as a biomarker for how many receptors for LDL receptors, CD36 receptors on adipose tissue. And those who have low PCSK9 have higher adipose tissue receptors, and they have higher risk factors for type 2 diabetes, basically dysfunctional adipose tissue and insulin resistance that is not compensated by insulin secretion. And therefore, we think that what happens in these subjects is that the uptake of LDL in adipose tissue promotes lipotoxicity and promotes activation of an innate immunity complex called the NLRP3 inflammasome. And the activation of this system promotes immune reaction and secretion of interleukin-1 beta, which is very well known to promote type 2 diabetes, and is known and is proposed to link the obesity to the type 2 diabetes that happens in obese population.